So if you have any suspicion, you should do cognitive testing. I believe you should do cognitive screening on all patients aged over 75 as part of your 75 plus assessment, with the patient's permission. If you ask patients for their permission, they generally will give it to you and they won't feel offended. When I examine students and they're doing cognitive testing on their patients, they say, I'm going to ask you some silly questions. I don't think that's the way to attack it. So we have a website, dementia-assessment.com.au, which has all the tools that you will need for assessing cognition, function, behaviour, agitation, aggression, quality of life. This is funded by the Department of Health and Ageing, and the actual tools are there for you. Most GPs are familiar with the mini-mental state. They don't all apply it accurately. Mini-mental state is very poor on frontal lobe tests. We've had people with frontal temporal dementia have a mini-mental state of 30 out of 30. If you want to do another test that's easy, do the clock drawing test. This is how you do it. You ask the person to draw a large circle. Then ask them to put all the numbers in to represent the hours of a clock. Watch them doing it. You can almost see the neurons connecting as they try and work it out. And then ask them to put in the hands to show the time 10 past 11. 10 past 11 is quite confusing because the 10, you actually have to put the hand to go to the 2. And people, the mistakes that I see commonly is they'll start with the hours, they'll put the 1 o'clock where the 12 is, because they're 12 hours and they start at 1. You see the people who are well organised go 12, 6, 3, 9, and then put in the middle. And then when they're putting the minute and the hour hand, they'll put in the hour hand for 11, and you'll see them thinking where to put the minute hand, and they'll put it towards the 10. But it's quite a useful test, and it's quick to do. We developed a test specifically for general practice, which is quicker than the mini-mental and is equivalent in its efficiency in diagnosing dementia. It's called the GP Cog. It takes about 2-3 minutes, and I'll show you that in a minute. There's a test being devised which is equivalent to the mini-mental for people from non-English speaking backgrounds, and that's the RUDAS. Jeff Rowland developed it. It's called the Rowland Universal Dementia Assessment Screen, and that's also on our Dementia Assessment website. This talk, by the way, will be on my website, and I'll give you that URL at the end. So 3/4 of people will consult with their GP after first noticing symptoms of cognitive decline. Most people consider that you are the most accessible health professional. You're the corner shop for health care, not the specialist. You also know your patient better. Many of you have known them for a generation. You've known them for many years. Often, particularly in rural practice, I find general practitioners are loath to diagnose dementia because of the stigma attached to it, maybe because of the fear of the general practitioner themselves about their own memory as well, their social relationships with the patient. Looking across studies, about half the people with early dementia are not diagnosed by their GP. Dimity Pond has led a study which I've been part of, Newcastle, Sydney, Melbourne, Brisbane, and in rural Victoria, Bendigo, yep. And the same figure came out, 50% were not diagnosed by their GP. So we asked GPs, gave them a list of their patients aged over 75, do you think any of these patients has definite dementia, possible dementia, no dementia? And then we had a nurse go in and spend an hour doing a more detailed assessment, and against that standard, 50% had not been diagnosed. More worryingly, 20% of people diagnosed turned out to be normal on the nurse's assessment, so there were false positives as well. So GP screen for cancer, for hypertension, for diabetes. If you've got a condition which is occurring in at least 10% of people aged over 75, and some figures are higher, why not screen? Well, maybe it takes too long, maybe you're not sure how to do it, Maybe you're not sure what the point is because there's no treatment. Well, there's no cure, but there's a lot you can do to treat the disease. And if you want to put them on a cholinesterase inhibitor, the rules are complicated, but there's been a change this month, in fact. So we did a study in 1994, and also there's been other studies that Dementia led more recently, and the same reasons come up. The reasons GPs don't want to diagnose dementia is it takes too long, they don't see the point, they don't think there's anything they can do, there's a therapeutic nihilism. They're unsure of their own skills or what the next steps are, and there's lack of knowledge about guidelines. There's not any extra remuneration. In some countries, there is an extra rebate for doing cognitive testing. Sometimes it's not the GP, it's the patient who hides the problem, or the families who hide the problem. There is a skill in breaking bad news, whether it be for Alzheimer's or cancer, and it's a matter of doing that gradually by degrees and titrating the amount of information to the amount that the person, the patient, is receptive to. You may be worried about the effect on the patient. Will they get depressed? Will they suicide? What will be the effect on the family? And there are cases of suicide in people being given a diagnosis. But in my, touch wood, 30 years doing this, I haven't found one. So here's the GP cog. It's a simple test. It asks the person to learn a name and address. John Thompson, 27 Bridge Road, Glebe. Get them to repeat it and say, and warn them, I'm going to ask you that in 2 minutes. Then they have to say what the date is, the 17th. Then to draw this clock, and here we see a clock drawn accurately on your left and the clock drawn inaccurately. It started with 1 o'clock, and you see they're squashing the 12 o'clock. I haven't quite worked it out here. They started with 1, and they come around to 11, and it just hasn't worked out. Then ask them to put in the hands of a clock to show 10 past 11. Then ask them for a current event. If they say, oh, there's a lot of politics on at the moment, that doesn't count. If they say Abbott did his reply speech to the budget last night, with some detail, that counts. If they say, oh, there's a war in Iraq, it's not detailed enough. And then ask them, can you tell me what that name and address was? And there are 5 points. John Thompson, 27, Bridge Road, Glebe. Bridge Road, sorry, is one time, and Glebe. Then they get that. If they get all 9 out of 9, they're fine. If they get under 5, then we know that there is a problem. And we designed this to be a streamline, so we wanted to combine history and testing. And we found that there's the intermediate people between 5 and 8, that's when it improves the test if you can ask an informant 6 questions. In the last 5 years, has your husband had more difficulty with memory, with finding the words for things, with recalling conversations? Are they less able to manage their finances, manage transport, or manage medications? And if they're saying more than 3 of those is indicating decline, then we're really worried about this could be early dementia. Now, these are screening tests. The mini mental state, the GP cog, whichever one you use, is not a diagnostic test. There'll be false negatives and false positives. It means you either have to keep going with further assessment or refer them on at that stage. The GP cog is web-based. You can do it from your computer. It has downloads. You can download the test, print it off, or you can do it online and save what you've done. It's available in 11 languages. There's a little here that's in English, but you can do it in Italian or French, Mandarin, Russian, Cantonese, Hebrew, Portuguese, Polish. There's quite a lot of languages there, and others being developed. There's also recommended standard investigations And there are the background papers about the GP cog. So that's all free of charge, and I encourage you to use that. So here's the typical example of the clock drawing test and drawing in the hands. There are other frontal tests you can do if you like. One of them is to do a tapping test. It's changing conceptual set. So when I tap once, you tap twice. When I tap twice, you tap once. Would you try a bit of that? Very good, okay. And then you can switch it. So when I tap once, I want you to tap once, and when I tap twice, don't tap. Good, okay, so you get the things. I'm not really a fan of the proverbs, which is one we were taught as medical students. There's a lot of cultural bias in proverbs. You know, a rolling stone gathers no moss. It can have a couple of different meanings, and if you've never heard it, it doesn't mean anything. Other tests we use are verbal fluency. So asking a person how many words they can generate. These are common nouns, common words, not proper nouns, starting with a certain letter, say F or P, it doesn't matter, but a common letter, and in 60 seconds. And there are norms for that. Or how many animals can they generate in 60 seconds, and you time it. And these are more frontal and temporal lobe tests. But the history is very telling. Do they have trouble following the plot of a movie? Do they not anticipate what's happening? You can tell in the conversation. Sometimes people will start answering you before you finish what you're saying because they're anticipating where you're going. That's all frontal lobe. Is there a change? They lost their sense of humour. Are they more rigid in their personality? Or are they becoming more disinhibited, saying things that are out of character or doing things which are passing wind or burping in social situations where they would never have done it before? These things are best picked up by someone who lives with them. 24/7 assessment is much more powerful than what we can do in a 15-minute consultation or an hour consultation.